Healthy Conversations is made possible through a grant from the William L. and Ruth T. Pendleton Memorial Fund.
Good morning, everyone. I'm Bonita Wilson. I'm a registered nurse and certified diabetes care and education specialist with Dignity Health Yavapai Regional Medical Center. And we are here today to talk about new technology in diabetes mellitus. And we are going to be talking about continuous glucose monitors, otherwise known as CGMs. So, what a CGM is, it is the latest and greatest way to monitor your blood sugars without really having to do the finger sticks. It allows you to continuously monitor your blood sugars and how they react to certain activities, to food, to exercise, to emotions. What they are is they're a device that a sensor sits right underneath your skin and it detects the level of sugar in your interstitial fluid. The sensor is placed by you. It's easy to do. There's a transmitter that transmits that data then from the sensor to the receiver or to a smartphone, or in some cases to an insulin pump. There are 4 different ones on the market, and we're going to look at those and we're going to compare those. So the first one out on the market is the FreeStyle Libre made by Abbott, and it has a FreeStyle Libre 14-day and a FreeStyle Libre 2. They are both worn for 14 days. There's minimal finger sticks with them. They are both smartphone compatible, so that means you don't have to carry an extra device. You can use your smartphone to scan the sensor and get your glucose values. The Libre 2 has high alerts and low alerts, so you can personalize your alerts. So if you want to be notified when your blood sugar is at 70, it can notify you that you're going low. Or if you want to be notified when it's high, you can set that alert also. So you can have both a high and a low alert with those. The Dexcom G6, it's a 10-day wear sensor, and it has minimal finger sticks as well. It can also be used with the smartphone, as well as a receiver, and in some cases, insulin pumps as well. The Dexcom is used with a tandem insulin pump and also an Omnipod insulin pump. The last one on the market is the Eversense, which is an implantable sensor. So a doctor has to implant it right underneath the skin on the arm, and it stays in there for 6 months. Now, this sensor does require calibrations, at least 2 calibrations a day. And what a calibration is that you would still need to do a finger stick at least twice a day, and you enter the finger stick into the receiver to calibrate the 2 numbers so that they're closer together. The Eversense is also compatible with the smartphone, so you can use that as well, and it also has high and low alerts. The last one out is the Medtronic Guardian Sensor, and it's a 7-day wear. This one also requires 2 calibrations per day, so that you will be doing 2 finger sticks per day. It is also compatible with smartphones, both Android and Apple. All of these are both Android and Apple compatible. The Guardian also has high and low alerts. The Guardian sensor works with the Medtronic insulin pumps. So what are the benefits of continuous glucose monitors? Well, one of the number 1 benefits is that there is actually a 1% drop in your A1C just from using a CGM. And I think that's because it allows the user to get instant data as to what's happening with their glucose. So if you were to eat a meal, instead of having to poke your finger, 2 hours later, you can actually watch the device to see what your sugar is doing in response to that food. When you do activity, you can see your blood sugars changing. So you tend to make more rapid decisions based on that instant results. You have fewer finger sticks. Like I said, with the FreeStyle and the Dexcom, there's minimal finger sticks. So you don't have to carry around extra equipment. It's very convenient. You can just look at your smartphone to see where your blood sugar is and make decisions. You get that fast response, so you know exactly what's happening. Greater insight. So just from having this data, and it is your data, it is personalized to you, then you can modify your life in ways that are healthier and actually then see those responses to your healthier choices. And then peace of mind. A lot of people just knowing that they have a device that's going to let them know if their blood sugars are going too low or too high, that they don't have to sit there and worry about it. You know, is my blood sugar going to go too low? Is my blood sugar going to go too high? Because they have a device that will tell them that this is happening. I've had people tell me they sleep better because they're not worrying about going low at night, because they know that the device will actually warn them and wake them before they even go low so that they can address it. So there is a lot of peace of mind with using these devices. They each have a report that the patient can review for themselves, and also the doctor. When you go into the doctor, it just gives the doctor more data to make more informed decisions about your care. So it's not a blanket kind of prescription. They're actually going to use your data to decide what's best for you. You can print these reports off. You can look at them on your smartphone. They talk about your time in range. So the American Diabetes Association has found that if your blood sugars are within a range of 70 to 180, at least 17 hours of the day, your risk of complications are reduced. With these devices, they allow you to look at a report and immediately know, are you within that range? And just knowing that is peace of mind as well, because you know that when you're within this range, your risk of complications is greatly reduced. So when we talk about time in range, so once again, I said the recommended range is 70 to 180. And for every 5% time in range increase, there is just more significant clinical benefits. Just those risk of complications is even further reduced. So the goal is staying within that range. And with these devices, you can actually look at the reports and you'll see the graph, the time in range graph. And so the more green you see, the better. But it's a really quick glance, you know, am I on the right track? And if you look at this and you do see more of the green, then you know I'm on the right track. And it'll actually give you a percentage of how often you're in that time in range. So that's really important. And that's your goal. So you always have a goal right there in front of you too. And we do better when we have goals. So if you want to learn more about diabetes management, we do offer classes. So if you are on Medicare, Medicare will cover the 10 hours of classes for the first year. Those classes cover basic diabetes education. You know, what is diabetes? What's happening in my body? We cover nutrition. We cover activity. We cover monitoring. We cover diet. And then we also cover drugs and complications. So we also offer one-on-one. So if you don't do well in a classroom setting, or maybe you've already done the 10 hours of class, we do offer one-on-ones. And we kind of cater those to what you feel you need more help with. So if you do want to meet with us, go to either the classes or do one-on-one, you would just need to contact your primary care physician and ask them for a referral to diabetes education. We also have a medical nutrition therapist. So if you felt that that was an area you needed work in, you could ask for a referral to see the dietitian as well. So there are certain qualifications that you need to meet in order for insurances to cover continuous glucose monitors. With Medicare, Medicare requires that you are doing 3 insulin injections a day. So if you're taking one of the once a week injections like Ozempic, Trulicity, B-Size, those are not insulin. So once again, Medicare requires 3 insulin injections. And then they do require that you are at least monitoring your blood sugars daily. Then you will be qualified for a CGM. There are other insurances out there that just require 1 insulin injection a day. And there are some that if you have a diagnosis of diabetes, you qualify. So I always say, if you're not sure, have your doctor run it through the pharmacy, run it through your insurance, and see what they say. All they can say is no, and then you would need to continue finger sticks, but at least try. I've also encouraged people that if you could afford to buy the Libre, even 2 sensors, which would be anywhere from $75 to $100 a month for 1 month, the data that it gives you is just invaluable. I mean, you can make life adjustments based on the results that you see. And you can make little life adjustments, but it's a lot of good data for you as an individual. So once you're referred to us from your primary care physician, and sometimes it comes in that you've already discussed with your primary care physician what you want to talk about or what he would like you to learn. But once you get in to see me, we really talk about you, what's going on with your life, what you've done to manage your diabetes, up to that point, or maybe you're brand new, with a new diagnosis of diabetes. And if you're brand new or newly diagnosed with diabetes, I kind of like to start from the beginning. You need to know what's happening with your body. And I think once you have a good understanding of what's happening with your body, it's easier to manage. People who've come to me who have had it for years, I kind of like to revisit what they've been doing or ask them, a lot of times they come in because their A1C has gone up. And so we like to find out, well, what have you done differently? What's differently in your life? And start with that. But it's very individualized as to you as an individual. What is happening with you at this time? Nope, we have type 1 children as young as 2, 4, 6 young who use CGMs. The parents, with a lot of them, especially the Dexcom is one where parents can have the child wear a Dexcom and they can actually monitor the child's blood sugars on their own smartphone. So they have this sense of security because they can always see what's happening with the child. And then same with adults, if it's always nice to know that someone else is there watching. So for some reason you had a low blood sugar, that your neighbor, you could even set it up that your neighbor could see your data and come over and say, hey, I noticed your blood sugar's low. Are you okay? Is there anything I can do? So recommended age? No, not at all. They're easy to use. They're easy to apply. So I don't think it doesn't take a special skill to put them on. A lot of people, worry about, oh, I have to apply this. Yeah, it's very easy. It's very easy to do. So I'm going to demonstrate how to put on a FreeStyle Libre sensor. So I want you to know that it is very easy to do. So when you get your sensor, it'll come in a box with these 2 items. One is the applicator and one is the sensor. So we're gonna have to put those together first. So you open your box and you take them out. You open it. This one is like opening a yogurt. and they're kind of tight because they're sealed for, to keep them sterile and clean. And then this one, it's like opening a new jar of pickles or something. It's not a nice hard turn. So that comes off. So you'll see then that these two will match up. You have a line here and a line here. So they make that kind of easy so that you line up the two lines, this line and this line. You put it in like that, it lines up, and you push it. You pull this out and it's ready to go. Then you take your alcohol pad, you're gonna choose the spot that you wanna wear, and I'm gonna choose my arm, and I'm gonna clean it with the alcohol, and I'm gonna let it dry. And with this sensor, I wanna make sure it is on the back of my arm, because I don't want it too much on the side, because I could rip it off with a seatbelt or walk through a doorway and knock it off. So I wanna make sure it is more on the back of my arm. So once again, you're gonna clean the spot, make sure it's dry. Then I'm gonna take my sensor that I've already gotten ready. We're gonna put it here, pop it in, take it off, and it's on. And then what you do is you take your receiver or your smartphone and you scan it and it starts warming up. And then put my shirt back down. And you can't even tell. Not really. If I would have put it up higher, you wouldn't have seen it. But you can wear it on your belly or the back of your arm. So that's how easy it was. If I can do it, I know you can do it. And they're all pretty much that same, like I said, except for the Eversense. The Eversense is an implanted one that the doctor has to implant. Medtronic, there's a couple more little steps, but the Dexcom is just as easy as well. So there you go. So thank you for joining us today. And if you would like more information on this, please join us at yrmchealthconnect.org. Thank you.